Candidiasis, overgrowth and infection of yeast. After the completion of this presentation, the viewer should be able to describe the pathophysiology, frequency, and implications of candidiasis, outline the natural and non-pharmacological methods used to treat candidiasis, and be able to compare and contrast the most common pharmaceuticals used to treat candidiasis, including mechanisms of action and potential side effects. Candida is a category comprising many dozens of yeast fungi species. However, only about 20 different species actually cause infections in people. The most common Candida agent that leads to infections is called Candida albicans. In general, Candida infections are referred to as candidiasis, and these infections can be localized or systemic. Common locations of candidiasis include the intestines, the mouth and throat area, genitals, and essentially within any moist fold of skin. Candidiasis commonly occurs in people with weakened immune systems and those who are on drug therapy, particularly for more than a week or two. The most common drugs to cause issues are antibiotics and corticosteroids. Focal candidiasis can spread throughout the body via the blood and lymph, and when this occurs, the systemic infections that develop can certainly be life-threatening. Candida comprise the most common cause of opportunistic fungal infections in people. Various species of Candida are part of the normal human flora and fauna of the GI system, but under certain circumstances they can become pathogenic and colonize the mucous membranes on the inside or the skin on the outside of the body. As previously mentioned, Candida albicans, also referred to as Monilia, is the most common species, and it accounts for almost 50% of all invasive candidiasis, particularly of the vagina. Different sources estimate that albicans is maybe up to 80% prevalent, but it seems in the last handful of years, 5 years or so, that other species are becoming more popular in terms of infectious agents. Next on the list is Candida parapsilosis at approximately 30% of cases. This species has a high natural resistance to antimicrobial drugs and can be particularly dangerous when in a hospital setting. Candida glabrata is a species that is rising in terms of incidence, greater than 15% of cases, and it is a very common cause of candidiasis of the mouth, also called oral thrush. Candida tropicalis accounts for about 10% of cases and is a main cause of septicemia and disseminated candidiasis. Candida krusei, relatively rare, about 1% of cases. It's most associated with infant diarrhea. And then also Candida lewisianae, fairly rare also, typically less than 1% of cases. And it's similar in many ways to Candida tropicalis. For the rest of this webinar, we will focus on the Candida albicans species, as this agent causes the most problems in people. It is a diploid fungus that grows both as a yeast and a filamentous structure, which is shown on the right in the picture. It lives in approximately 80% of the human population, particularly in the GI tract, and it normally causes no harmful effects or noticeable symptoms. To infect the host tissue and the mucous membranes, the usual unicellular yeast-like form reacts to various environmental cues, such as changes in temperature, changes in pH, particularly a lowering of the pH, and changing in other flora and fauna, for example, the bacterial species. And this unicellular yeast-like form then switches or changes into an invasive multicellular fungal form, typically called a hypha. This phenomenon in general is called dimorphism because albicans can exist as two completely different forms. The hyphae are more virulent and can deeply penetrate tissue and burrow into the mucous membranes in various places such as the GI tract, vagina, mouth, etc. As such, Candida albicans is considered a true opportunistic pathogen. In the United States, Candida species are the most common fungal infections in people who are immunocompromised and have other diseases that tend to lower immunity. Oropharyngeal colonization is found in up to 55% of healthy young adults and detected in up to 65% of their feces. And this is without causing noticeable symptoms most of the time. 75% of women, American women, will experience at least one bout of vulvovaginal candidiasis, abbreviated VVC, during their lifetimes. This is likely the most prevalent of any other country in the world. Candidiasis is particularly common in HIV patients, particularly those that have progressed to AIDS. 90% of these patients eventually develop oral thrush, which is another term for oropharyngeal candidiasis of the mouth and throat. In people with systemic infections, Candida species are now the fourth most common isolated pathogens found in the blood. So again, Candida, particularly Candida albicans, is very opportunistic. Similar rates of candidiasis or candidemia, which is the spread of Candida within the blood, have been observed in industrialized countries, but slightly higher rates of infection are found in developing countries where a larger portion of the population tends to be malnourished and have immunity issues. About 15% of focal Candida infections spread throughout the body to become systemic. And the mortality rates of these systemic infections, candidemia, have not improved much over the years and remain between 30 to 40%. Systemic candidiasis causes more cases of fatalities than any other systemic mycosis. Although neither gender is more predisposed naturally to candidiasis, VVC is the second most common cause of vaginitis, which is infection and inflammation of the vagina. Candida is not considered an STD per se, although sexually promiscuous people have much higher incidences. And this is mainly because sexually promiscuous people have much higher rates of urinary tract infections, and then typically people take antibiotics for the UTIs, and a relatively high percentage take it for more than a couple weeks, which dramatically increases the risks of destroying the so-called friendly flora and fauna, which then allows the Candida species that are already there to become opportunistic and flourish and become infective. Neonates and adults greater than 65 years old are most susceptible to candidiasis, and that's typically because of either an immature immune system with the neonates or a compromised immune system with the elderly. As I mentioned earlier, a weakened immune system creates the greatest risk of developing candidiasis. Diseases such as HIV infection / AIDS, diabetes, cancer, thyroid and pituitary disorders, and other sexually transmitted diseases all work to compromise immunity and put you at risk for a Candida infection. Also, treatment protocols such as chemotherapy and radiation, which are typically done for cancer, also dramatically compromises immunity. Of course, poor nutrition or malnutrition, high levels of stress, chronic lack of sleep, also reduce immune response. And as noted, focal Candida infections spread systemically in about 15% of cases. Another common cause of candidiasis is the use of antibiotics, particularly broad-spectrum ones, and for more than a couple of weeks. Essentially, the antibiotics kills off too much of the good flora and fauna, and it upsets the balance, not only needed for proper digestion, but also strong immune response and even normal pH levels. Candida, of course, is opportunistic and quickly takes advantage and rapidly overgrows. Keep in mind that meat and dairy products, as well as some municipal drinking water wells, can also be contaminated and be a source of antibiotic residues. Other pharmaceuticals that can cause issues and allow Candida to overgrow include steroids, migraine meds, birth control pills, immunosuppressive drugs, and even synthetic hormone supplements. Aside from malnourishment, there are certain dietary choices that can increase your risk of Candida infection. High-starch diets, too much coffee, meat, alcohol, refined and artificial sugars dramatically increase acidity, i.e. lowering the pH level within tissues, which provides a good environment for Candida to flourish. Also, many of these items, refined sugar, alcohol, high starch, gives Candida a quick source of glucose energy. Important nutrient deficiencies include zinc, selenium, and vitamin D, which are all involved in boosting immunity and keeping it strong. Gluten sensitivity and lactose intolerance can certainly complicate candidiasis of the GI tract. Poor hygiene is a factor. Not washing appropriately can cause Candida to proliferate in skin folds and within the vagina. People who are obese and or with reduced mobility simply cannot reach the areas that need to be washed appropriately. Environmental factors can be very significant factors for Candida. They're often overlooked. Being exposed to glues, petroleum-based solvents, silicone, dry cleaning chemicals, formaldehyde, pesticides becoming more common in the environment, bisphenols found commonly in plastics, and heavy metals such as lead and mercury all can contribute to Candida risk, either because they compromise immunity or they might be able to reduce the friendly flora and fauna in the GI system, allowing Candida to flourish. It's important to note that candidiasis can essentially develop anywhere inside or outside of the body. Oropharyngeal candidiasis, commonly called oral thrush, infects the inside lining of the cheeks, the top and sides of the tongue, and can spread to the back of the throat. Symptoms include light-colored, cheese-like raised lesions that can be quite tender or painful, and this makes chewing and swallowing quite difficult. Bleeding gums and a sore throat are quite common with oral thrush. It can often lead to cracking of the skin at the sides of the mouth. It can produce a sweet, musty-smelling breath, which is quite characteristic. Commonly occurs among kids taking antibiotics. In fact, it does occur in between 5 to 7% of neonates, 20% of cancer patients. Of course, that rate increases as the cancer progresses and spreads within people. And as noted earlier, HIV-positive people, where it's progressed to AIDS, at least 90%, if not greater, will experience oral thrush. Cutaneous candidiasis, often just called fungal skin infections, are common in warm, moist regions of the body, such as underneath the arms and the armpit region. the cleft of the buttocks, underneath breasts, and folds of skin that may be caused from being overweight or being obese. As such, obese and large-breasted elderly women are perhaps at the highest risk of fungal skin infections, especially if they can't reach those areas to clean thoroughly. Candida skin infections can appear gray, particularly if they're more chronic, or reddish and inflamed in color if they are more acute, but either way, they're often itchy. These skin infections are usually inflamed to some extent. Blisters can form, and they have that characteristic sweet, musty odor. Keep in mind that some diaper rashes can be caused by yeast infections, and typically it'd be characterized by yellow fluid-filled spots that can break open and become flaky. Onychomycosis is the term for fungal infections of the toenails or fingernails. It causes the nail beds to thicken, split, and crumble. The nail beds initially might turn whitish, but eventually turn either yellow or gray as the condition progresses. The fungal form of Candida burrows deeply into nail beds, which makes it very difficult to eliminate with either pharmaceuticals or natural remedies. This sort of infection is frequently associated with people who immerse their hands and or feet in water due to their job, perhaps, and also quite common in people with diabetes. The nail infections can often spread to infect adjacent nail beds, and it can frequently result in complete loss of the nail. And like the other types of infections, onychomycosis also produces the sweet, musty odor. Vulvovaginal candidiasis, or VVC, is usually just called yeast infection, and many women are familiar with this. It typically leads to genital itching, burning, and sometimes a clumpy cottage cheese-like discharge. Vaginal soreness and inflammation are very common, and it often leads to painful intercourse and or urination. As mentioned, it's not considered an STD per se, but male partners of women with yeast infections can develop short-term rash or burning sensations on their penis. Of course, it's dependent on condom use. If they're wearing a condom, they're typically protected. If not, then the hyphae from the vagina is able to attack and cause irritation on the skin of the penis, but often it does not become an infection because a healthy immune system can quite easily fend off the candida, even if it's in fungal form. Men with poor immune response, particularly those with cancer, AIDS, or progressed diabetes, can also develop candidiasis around their genitalia, and this is often referred to as balanitis. Balanitis from Candida infection is characterized by inflammation, redness, extreme itchiness, and burning pain. Much like vaginal yeast infections, intercourse and urination is often very painful. More common in uncircumcised men, because the presence of a foreskin promotes accumulation of the cheese-like yeast substance and also makes it a little bit more difficult to clean and get rid of the accumulation. These foreskins can swell and crack, greatly contributing to the itchiness and the pain. The infection can spread from the penis to the scrotum, thighs, and or buttocks. And again, it's not considered an STD, as a normal, regular, healthy, functioning immune system can quite easily fend off the Candida. Candida species are normally commensals of diseased skin and mucosal membranes of the GI tract, the GU, and respiratory tracts. Candida species contain their own set of virulence factors. For example, they have surface molecules that can adhere to other structures, for example, mucous membranes. They release acid proteases and phospholipases that penetrate the cell envelopes, the cells especially of the mucous membranes, but also on the outside of the body, on the skin. And they have an ability to convert to a hypha form, which is referred to as dimorphism. Another term for it is phenotypic switching. There are also host quote-unquote defects that allow for the Candida infection to progress, and these include, as mentioned, poor compromised immunity, which is essentially a lack of white blood cells and a lack of immune response, disrupted flora and fauna, i.e. friendly bacteria caused by broad-spectrum antibiotics and other meds, in general wounds, possibly from IV catheters, cuts, burns, ulcerations on the inside of the body in the mucous membranes or on the outside skin, allows the Candida to easily penetrate the body. Organ, bone, marrow transplants and other surgeries, of course, are known to severely compromise immune response. Severe trauma in general, whether it be physical or emotional, and this also includes premature birth, also due to compromised immunity. The first step in the development of candidiasis is colonization of compromised mucocutaneous surfaces. And the routes of Candida invasion include either easy access to the bloodstream via disrupted or compromised skin or mucosa, either due to trauma, burns, cuts, IV catheters, etc. So it makes it easier on the Candida to get in and access the blood. Or sometimes they have to work a little harder by deeply penetrating the mucous membranes, for example, the GI wall, and then they get to the bloodstream via that method. Leaky gut syndrome makes it easier for the Candida to penetrate and get into the bloodstream. Leaky gut syndrome, of course, is characterized by increased porosity within the initial portion of the small intestine. Leaky gut syndrome is usually caused by insensitivity, or I should say an increased sensitivity to gluten. Once the Candida starts to proliferate in the blood, referred to as candidemia, systemic colonization is imminent. Typically about 15% of focal infections do become systemic, and as mentioned earlier, of the ones that become systemic, 30 to 40% of those cases are fatal. The vital organs that are affected the most include the brain, the heart, and the kidneys. As noted, about 15% of focal candidiasis becomes systemic, particularly within patients with severely reduced immune function, whether that be from advanced cancer, diabetes, AIDS, or other diseases that compromise immunity. Of this 15%, between 30 to 40% result in death due to widespread infection of vital organs. Encephalitis of the brain, endocarditis of the heart, and nephritis of the kidneys are the most common causes of death. Of course, it depends on the severity and location of the infection, and also the ability of the patient's immune system to fight it off, but there are a wide range of therapies and treatment protocols, and doses and frequencies that are used to treat candidiasis. Drug therapies are of course a mainstay and include classes such as triazoles, imidazoles, polyenes, echinocandins, and even low-strength corticosteroids. Dietary modifications can make a big impact, reducing sugar intake. As noted, Candida loves sugar, loves glucose for energy. Low dairy for much the same reasons. Less processed food, more alkalizing foods such as fresh fruit and vegetables. No alcohol, and reducing some nuts, particularly peanuts and maybe even walnuts, which tend to be quite moldy. Herbal remedies. There are many plants that have antifungal properties, and we'll get into these in more detail in the next few minutes. But garlic, oregano, tea tree oil, olive leaf extract, grapefruit, seeds, fresh cloves, echinacea, pomegranate juice, all have impact. Other supplements can be important: vitamin C, essential fatty acids, probiotics, B. propolis. Lifestyle changes can be important too. For example, wearing breathable undergarments that are 100% cotton, for example, can reduce humidity within folds of skin or within the vagina. Better hygiene in general. Perhaps it requires losing weight or becoming more mobile, rehabbing from an injury, for example, and of course more responsible use of antibiotics. As noted previously, Candida species essentially need poor immunity, reduced microbial competition from the friendly bacteria in the gut, and a source of easily processed energy, such as refined sugar, alcohol, etc., in order to thrive and flourish. Many herbs and plants can deter Candida and other types of microbes, particularly green leafy examples such as kale, Swiss chard, bok choy, collards, arugula, watercress, and turnip greens. Other good veggies that can combat Candida and other microbes include hot peppers, broccoli, celery, onions, zucchini, and Brussels sprouts. Fruits that can be effective at deterring Candida growth include essentially all citrus fruits, pomegranate, and coconuts. Keep in mind that fresh, raw produce almost always packs more of a medicinal punch. The only example I can think of that might go against that is stewed tomatoes tend to have more bioavailable lycopene than fresh tomatoes. But essentially all other fruits and veggies are more powerful when eaten fresh and raw. One of the most powerful herbal remedies to fight Candida is raw garlic. Raw garlic contains allicin, a compound proven to kill fungi and many other microbes. In terms of doses, take 1 clove daily, or 1 tablet with between 4,000 to 5,000 micrograms of allicin. Of course, keep in mind that raw garlic does increase the risk of bleeding and interacts with a variety of meds, so it should not be combined with blood thinners. Coconut oil, very powerful also, contains 3 different fungicidal fatty acids: caprylic, capric, and lauric acids, and these are effective against Candida in particular. The fatty acids kill yeast directly by destroying the cell walls, so they are truly fungicidal. Resistance to this is very unlikely. Start with 1 to 2 tablespoons each morning and possibly increase up to 5 to fight Candida. Oil of oregano is also powerful. Contains the compounds carvacrol and thymol. Both are also fungicides that completely destroy Candida albicans via dehydration. Also effective for preventing Candida infections. Start with 3 drops per day diluted in water and increase up to 6. Oil of oregano can be taken by itself and can be put under the tongue, for example, for better absorption, but it does cause quite a burning sensation that lasts for perhaps 3, 4, 5 minutes. Grapefruit seed extract is also a good natural remedy for Candida infections. It's not only a good antifungal, but it also contains vitamins C and E and bioflavonoids such as hesperidin, and they all boost immunity, which of course is helpful. Start with 10 drops diluted in water 3 times per day, and grapefruit seed extract can safely be added to vaginal douches. Olive leaf extract contains oleuropein, a strong fungistatic, which disrupts the fungal cycle, doesn't kill the fungus directly. Also stabilizes blood sugar, which can be an important factor in Candida. Take 2 capsules that are at least 20% oleuropein 3 times daily with meals, and it combines well with vitamin C for synergistic effects. Other herbs that can be quite beneficial in combating Candida include golden seal, fresh cloves, fresh ground cinnamon, sage, tea tree oil, fresh pomegranate juice, and echinacea extracts. Essentially, all of these have not been studied very well in regards to Candida. A good dietary supplement to take to help combat Candida would be vitamin C. Current RDA values are far too low. I think for elderly people who smoke, I think the top value is 125 milligrams per day, which is way too low. Human beings, along with other higher primates, I believe guinea pigs and fruit bats are about the only animals that do not produce vitamin C internally. Your cat, your dog do, you do not. Linus Pauling, the famous 2-time Nobel laureate, recommended at least 3,000 milligrams a day for adults. It's a strong antioxidant, able to not only destroy free radicals, but of course it stimulates immunity. It displays antifungal properties, and it's also needed for tissue repair in terms of making collagen, which can be important for recovering from a Candida infection to repair the mucosal membranes. Vitamin C also helps to alkalize the blood and other body fluids. Yes, it's ascorbic acid, and outside the body it would be a low pH or acidic, but it has alkalizing effects once you take it into your body. Doses should range from 1 to 3 grams daily. If you take too much at one time, your body will tell you by showing you some loose stool and diarrhea. So I wouldn't recommend taking all 3 grams at one time. Omega-3 fats are important, and they include ALA, EPA, and DHA. They have strong anti-inflammatory properties and also aid in tissue repair. Too much omega-6, such as from primrose oil, cancels the benefits of omega-3s. The American diet is very high in 6 compared to 3s. The ratio should be closer to 1 to 1, but it's often as high as 20 to 1 in favor of omega-6s. EPA and DHA are found in fish oils, ALA primarily in flaxseed, hemp, and walnuts. Although again, walnuts can be on the moldy side, so perhaps that's not the best source. Omega-3 fats may increase the risk of bleeding and shouldn't be combined with blood thinners. And in terms of dosage, starting with 1 gram, going between 2 to 4 times daily. Probiotics such as Lactobacillus acidophilus or Bifidobacterium can be important for combating Candida. They help to restore normal balance of bacteria in the GI and mucous membranes. Taking these probiotics, which can be referred to as quote-unquote friendly bacteria, with antibiotics may help prevent buildup of Candida, although the evidence from studies are mixed. Natural sources of these probiotics include yogurt and kefir, but on the brands they must say contains live or active cultures. So not all yogurt does contain active cultures. Read the labels. If you're taking supplements, focus on ingesting at least 10 billion colony-forming units per day if you have a Candida infection or are trying to prevent one. Boric acid, borax, contain the mineral boron. These products, they're mined from dried salt lakes. Believe it or not, boron and borax, boric acid are excellent fungicides and can be used to treat Candida. Prevents yeast from becoming the hypha stage. In terms of dosage, either between 1/8 to 1/4 of a teaspoon of borax powder per liter of water daily. And taking that for up to a week or so should be effective. Hydrogen peroxide is a controversial Candida remedy because on the one hand it can be a good general antimicrobial externally, in other words applied to the skin, but it may promote Candida growth when taken internally because it does kill the friendly flora and fauna of the GI tract, which then would allow the opportunistic Candida to flourish. So I would not recommend ingesting hydrogen peroxide internally, particularly to fight Candida. Bee propolis is a resinous mixture of tree sap, buds, and leaves that bees make to seal their hives, but it also has great antifungal properties, as noted in various test tube studies. One human study showed that propolis eliminated oral thrush in people with denture stomatitis or mouth sores. However, this would not be appropriate for people with allergies to honey. Colloidal or ionic, or sometimes called atomic silver, is one of the most powerful and effective natural antimicrobials, antibiotics, and antifungal agents known, believe it or not. These silver ions or atoms show potent effects against Candida, comparable to amphotericin B and even superior to diflucan. No microbe can develop resistance against silver ions or atoms in solution. The main issues here are particle size, purity, and cost. The smaller the particle size, the more effective it is. Obviously, the more pure, the better. And in terms of cost, buying it at your local health food store can be very costly. Therefore, learning to make it at home in a very pure state is the best idea and most economical. It's great for oral rinses and vaginal douches for all sorts of infections, including Candida. Localized cutaneous candidiasis is treated with topical over-the-counter antifungal agents, and there are many to choose from, such as clotrimazole, iconazole, cyclopirox, miconazole, ketoconazole, and nystatin. And these are available as creams and gels within shampoos and ointments. Application for up to 4 weeks is usually sufficient. If it isn't, there is a problem that requires more investigation. If the topical infection is quite deep, drainage of the abscess, if necessary, and oral systemic antifungals are certainly indicated. For infection of the nail beds, onychomycosis, oral itraconazole or sporanox appears to be the most effective. And there's 2 treatment regimens that are recommended, either a daily dose of itraconazole for 3 to 6 months, dosage ranging from between 100 to 150 milligrams daily, or there's a pulsed dose regimen, requires a higher daily dose, say 200 milligrams, for 7 days, followed by a 3-week hiatus, and this cycle is repeated for 3 to 6 months. Fluconazole, brand named diflucan, is the agent of choice for candidemia, vaginal yeast infections, and oral thrush, primarily because it's effective, relatively non-toxic with few side effects, and the only antifungal that passes the blood-brain barrier in order to treat central nervous system infections. It's a triazole, which are fungostatic. They inhibit the enzyme 14-alpha dimethylase. Some Candida species have developed resistance to fluconazole, which is why it's often used in combination with other antifungal agents. For Candida, doses widely range from as low as 150 milligrams weekly to 600 milligrams daily. Depends on the person and the state of their immune function, and depends on the how far the infection has spread. It's available as solution, cream, or tablets. Voriconazole, or Vfend, is a newer triazole and used on Candida species resistant to fluconazole, and it's also appropriate for invasive systemic infections. It's a little more toxic to the liver compared to fluconazole, but fewer side effects compared to amphotericin B. Vfend is considered basically a salvage therapy for infections that don't respond to other meds. And in terms of a systemic infection, the common dosage is about 200 milligrams twice daily. Sporanox, another triazole, given orally or by IV. As I mentioned, it's widely used to treat fungal nail infections, and it seems to have a slightly broader spectrum of activity. Noxaphil, triazole given orally as a liquid. A couple different studies suggest it may be superior to other triazoles in the prevention of invasive fungal infections, but on the other hand, it may cause more serious side effects. The loading dose is 300 milligrams 2 times on the first day, and the maintenance dose is 300 milligrams daily for up to 2 weeks. There are a variety of imidazoles, such as Nizoral, Mycilex, Monistat, and as I mentioned, they are in over-the-counter shampoos, creams, and lozenges. And by the way, the difference between the triazoles and the imidazoles involves the mechanism of inhibition of the cytochrome P450 enzyme. Triazoles have a higher specificity, making them more potent, but at the same time a little less toxic. Flucytosine, brand named Ancobon, demonstrates great killing ability for Candida species, although many are quick to become resistant to it. As such, it's often combined with other antifungals, such as fluconazole or amphotericin B. Recommended daily oral dose is between 50 and 150 milligrams per kilogram of body weight, divided into 4 equal doses every 6 hours. A big downside for this drug is its very high cost. Amphotericin B, which goes under many different brand names, is a polyene, which is fungicidal, meaning it kills the Candida directly, but it is considered the most toxic antimicrobial in clinical use, especially for the liver. It's not absorbed in the GI tract, so it must be IV administered for systemic infections, and it's often given along with fluconazole. Initial IV infusion of between 1 to 5 milligrams per day, and that's slowly increased to about 0.5 milligram per kilogram body weight per day. It's also available in different lipid formulations, which have been developed to improve patient tolerability and reduce the side effects and toxicity, but these different formulations may show different characteristics from the original. Nystatin, brand names Mycostatin or Nilstat, is also a polyene and sold primarily as oral rinses and lozenges meant to combat oral thrush, but it's also available as a cream for vaginal yeast infections. The daily doses vary quite a bit, from 100,000 units for oral thrush, for example, up to 1 million units for systemic infections. It's not absorbed in the GI, so there are no problems with drug interactions. Echinocandins is another class of antifungals that include caspofungin, mycofungin, and anidulafungin, and these are included in the newer recommendations as of 2009 to use to fight Candida species. And these are essentially glucan synthesis inhibitors. They kill yeast and fungus without destroying the cell wall. They are the newer fungicides with minimal toxicity and typically administered via IV. For example, caspofungin, brand named Candidiasis, is more effective and less toxic than amphotericin B and the other triazoles. Clinical data suggests that anidulafungin is more effective in treating severely ill systemic candidiasis patients than fluconazole. And in this study, there was an increased rate of survival also. Topical corticosteroids, such as Topicort, do reduce inflammation, but they also suppress the immune response. Therefore, the anti-inflammatory properties of these topical corticosteroids can be helpful for Candida infections of the skin, and they also help reduce the itchiness and the redness. However, reduced immune response may actually promote the spread of systemic candida, as I've described in previous slides. As such, these topical corticosteroids are better suited for other skin conditions such as psoriasis. Furthermore, long-term use of these corticosteroids can cause thinning of the skin and numerous other side effects, including weight gain, hair growth in inappropriate areas, and mood problems. Acute vulvovaginal candidiasis, or VVC, can be managed with either topical antifungal agents or a single dose of oral fluconazole, typically 150 milligrams. Antifungal vaginal suppositories or creams are commonly used and effective. The duration can range from 1 day to 7 days of therapy and is typically between 80 to 90% successful for an isolated acute VVC episode. A small percentage of women, i.e. less than 5%, do experience chronic recurrent VVC, which often requires longer-term oral triazole therapy. In such patients that have chronic VVC episodes, the recommendation is fluconazole, 150 milligrams every other day for 1 week, followed by weekly 150 to 200 milligram doses for 6 months. This regimen prevents reoccurrence in more than 80% of women. Of course, natural douches can be used and can be quite effective, containing ionic silver and or coconut oil and or grapefruit seed extract, or possibly even tea tree oil. But of course, these therapies are not well studied for Candida at all. When yeast or fungal cells are rapidly killed in the body, a die-off occurs, leading to symptoms that's called the Herxheimer reaction, because their metabolic products are released into the body. For example, Candida yeast cells release 79 different toxins when they die, including the very toxic ethanol and acetaldehyde. These strong toxins can impair brain function and affect the endocrine, immune, and respiratory systems, and they are what often lead to the brain fog and fatigue experienced by people suffering from Candida and trying to rid themselves of it. Other Candida die-off symptoms include nausea, headaches, dizziness, gastrointestinal discomfort, joint and muscle pains, chills, fever, and sweating. It's important to note that both pharmaceutical and natural antifungals can cause these die-off symptoms. Therefore, the goal is to take antifungals at doses and at frequencies that limit die-off symptoms, which of course will vary from person to person. Healthy liver function is crucial in eliminating toxins from the body and minimizing die-off symptoms, so people with liver diseases are at greater risk for suffering greater Herxheimer-type reactions. Major organ infections associated with candidal abscesses may require surgical drainage procedures, along, of course, with systemic antifungal medications. Prosthetic joint infections with Candida often requires the removal of the prostheses. Surgical debridement is usually necessary for joint infections caused by Candida, especially vertebral osteomyelitis. Splenic abscesses occasionally require a splenectomy. And furthermore, heart valve replacement surgery is always indicated to treat endocarditis caused by Candida infections.